So, Dr. Koshy, what can be done about the sometimes confusion or anxiety around waiting for test results? Sometimes patients don't know when to expect them, or there are delays and don't understand why. What's happening, and what can we do to make that go as well as possible?
Yeah, I mean, I think there's two ways to look at it. It depends on what the test is, and so there are limits on the test itself, and then it depends on how your healthcare system is organized. So for the test itself, there's not really just one test that will answer most things. So usually you're trying to put a picture together with maybe multiple different tests. And so it takes time for those tests to come back. So one test might come back, but it won't give you the correct answer or the definitive answer. So you kind of need to wait for maybe some of the other tests you've ordered to come back to put that picture together. So that can take days, sometimes even weeks. Some of the tests are limited in that you might start with one test and it's a screening test. If the lab finds that there's something abnormal about it, they don't report it right away. They'll do a confirmation test. So sometimes that test itself will take another couple of days. So you may start out thinking you'll have your results back in 2 days, but if the lab has sent it off for some more confirmation testing, it might come back a week or 2 weeks later, depending on the type of test. And then a lot of the tests aren't necessarily done where you're getting the test drawn or ordered.
Your doctor's office, you mean?
Right. So you might have to send a test out to a special lab. And so some of those labs will run a test only on certain days. So you may not get the special test you need, may not be running on a Monday, it has to wait till a Thursday, and that's another delay. But your doctor won't know that necessarily, depends on the lab. And then in the end, it's really about how you guys communicate. So your healthcare system may be organized in a way that it's clear who's going to get back to you about the test and how they're going to get back to you. But that communication pattern is sort of dependent on how they've organized it ahead of time and how you know that they're going to follow up on things with you. So things you could do are, one, find out what tests are happening and sort of what to expect from the results. And then another way is just to set up ahead of time, maybe who do you think is going to follow up with you? Is it your doctor, or is it another person in your care team that might be calling you? And maybe having a backup plan, like if I don't hear in a week, can I call you back? Or, check in that way, and then you'll get maybe an update about whether things are back yet or not. But you don't have to just sit and wait and wonder.